Hello, and welcome to the online training session for Getting to and Going Beyond PSEs. This presentation was developed by Urban Health Partnerships in 2018 for the Live Healthy Community Partnerships of Live Healthy Little Havana and Live Healthy Miami Gardens, funded by the Health Foundation of South Florida. Before we dive in, please take a moment to make sure you have a piece of paper and a pen or an electronic device with which to participate, record notes, and jot down ideas. Additionally, you can download an 8-step planning framework to develop a strong community action plan and a document on strategic direction and strategies to accompany this presentation. At the end of the meeting, you'll be asked to complete an online evaluation associated with this presentation. A community action plan is a framework or plan to create shared investment among a diverse set of stakeholders to tackle a specific objective or area of need. As an example, increasing the total miles of physical infrastructure for walking, or increasing patient and community engagement in healthy behaviors to prevent diseases like diabetes or HIV. They do this by implementing PSEs. PSEs, or Policy, Systems, and Environmental Changes, are effective mechanisms within a community action plan or roadmap toward a desired outcome. So thinking about any roadmap toward change, or what your experience has been with a community action plan, in your opinion, what are a few elements that make a community action plan strong? There will be a short pause for you to take a moment and jot down a short list on paper or via the electronic recording device of your preference. So at this point, what are you thinking about? Have you included what you feel makes a community action plan or a CAP strong or successful? We'll take another moment to give everyone a chance to participate. If you still need more time to complete the exercise, feel free to pause the video here. Thanks for participating. We'll be discussing elements of a successful CAP in detail later in this presentation. For now, though, let's move on to the fun part. What it is that we're going to learn about today. First off, there are a few strong planning frameworks, practices, and theories that have been shared and implemented within the Live Healthy Little Havana and Live Healthy Miami Gardens initiatives. These include collective impact, results-based accountability, or RBA, and policy systems and environmental changes, or PSEs. All of these are valuable, and today we will demonstrate how they overlap and complement each other in forming strong community action plans, or CAPs. Additionally, we will review an 8-step framework that has collective impact at its core and includes various elements of the other practices and theories, including RBA, and promising PSEs to develop a strong CAP. Elements that make implementing PSE changes in place-based initiatives successful will also be identified, as well as what evaluation metrics and measures are needed to ensure success. And finally, Objectives 5 and 6 are focused on increasing the ability to apply PSEs to various focus areas and increasing your understanding of PSEs and how to incorporate them into your organization or company's work. Social determinants of health are conditions in the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. According to David Kindig, MD, a University of Wisconsin population health expert, clinical care contributes only about 20% to overall health outcomes, while health behaviors contribute 30%, social and economic factors 40%, and the physical environment 10%. This means that non-clinical care factors, or social determinants of health, are responsible for an estimated 80% of health outcomes, and that improvements in clinical care can only be part of the answer to the need for improved community health. The conditions, settings, patterns of social engagement, and sense of security and well being are also affected by where people live. According to Healthy People 2020, examples of social determinants of health that have been well documented include availability of resources to meet daily needs, access to job opportunities, access to healthcare services, transportation options, public safety, social support, exposure to crime, language and literacy, access to mass media, and even culture, to name just a few. The physical determinants of health that are also addressed within the social determinants of health framework include natural environment, such as green spaces, built environment, work sites, schools and recreational settings, housing and community design, exposure to toxic substances, physical barriers, especially for people with disabilities, and aesthetic elements such as good lighting or trees. Virginia Commonwealth University developed a series of life expectancy maps to illustrate how the opportunities that lead to a long and healthy life can vary dramatically by neighborhood. Across America, babies born just a few miles apart have dramatic differences in life expectancy. In Miami-Dade County, between Overtown and Allapattah, located northwest of downtown Miami, and Key Biscayne, a town on a barrier island just across the Rickenbacker Causeway, there's only a 15-minute drive and yet a 16-year difference in life expectancy between the two areas. Within the same city, Brickell, which is only an 11-minute drive or an 18-minute ride on transit, has 15 years more of life expectancy compared to Overtown and Allapattah. Both Little Havana and Miami Gardens are referenced with 6 to 14 years less of life expectancy relative to Key Biscayne. The gaps in life expectancy and overall health across these neighborhoods stem from multiple factors known as our social and physical determinants of health. For those of you that have been part of the Live Healthy Community Partnership since its inception, thinking in place-based terms might come naturally. But it wasn't that long ago, actually in 2010, only 8 years ago, when President Obama directed the Offices of Management and Budget, Domestic Policy Council, and the Office of Urban Affairs to conduct a comprehensive review of federal programs affecting places, the first of its kind in 30 years. Agencies across the administration, including the Department of Education, were charged with orienting programs and initiatives around a community-centric context. This in part was due to the compelling evidence contributed by the public health field. Now, the most promising initiatives are based on experience that shows that families do better when they live in strong and supportive communities. The Center for the Study of Social Policy discusses this in depth as they leap toward action in communities of greatest need. Live Healthy Community Partnerships is a place-based initiative. The Health Foundation of South Florida aimed at improving community health indicators, and as such, they allocated up to $7.5 million to support 2 Live Healthy Community Partnerships over a 6-year period between 2014 and 2020. After an extensive application process, the City of Miami Gardens and the neighborhood of Little Havana were selected. But with what do we arm ourselves and the community to propel us to meaningful action? Whichever formula the community decides is the right one for them and their partners to address these issues is translated into a community action or CAP. Earlier during this training, you were asked to jot down which elements you felt were part of a strong community action plan. What were they? Did they include goals and data, the community's voice, participation, and perspective? How about a roadmap or an implementation plan, resources to make it happen, or even the thought of how to sustain the action once funding has expired? So what is CI? Collective impact. How about RBA? Results-based accountability. and PSE, policy, systems, and environmental changes. What do these have in common? They all want a result that improves a community health indicator. And although collective impact focuses on developing the common agenda among members, while results-based accountability focuses on the desired goals from step one and brings us back to end at the end, policy, systems, and environmental changes are low-cost but high-impact strategies that are evidence-based and can be incorporated into both RBA and the action plan for a collective impact venture. These are all part of Live Healthy Community Partnerships toolbox: collective impact, results-based accountability, and PSEs. This is the common visual used to describe the collective impact model. The arrows on the left are going in all directions, while the arrows on the right are all headed in the same direction. Based on what has been said about the collective impact model so far, which drawing would depict the essence of this framework, A on the left or B on the right? You got it, B on the right, where all arrows are going in the same direction. There are 5 elements to the collective impact framework. First, having a common agenda where all parties move toward a shared goal. Second, having common measures and metrics that get us to the true outcome. Third, having mutually reinforcing activities where we can leverage each of the partners' expertises in attempting to reach the overall goal. Fourth, relying on a culture of communication that is open, transparent, and continuous. And 5, having a backbone agency, the partner chosen to staff the initiative, that can keep the momentum and facilitate the implementation of steps 1 through 4. A few reasons clear impact states are the right reasons to use RBA is because it gets from talk to action quickly, is a simple, common sense process that everyone can understand, helps groups to surface and challenge assumptions that can be barriers to innovation, builds collaboration and consensus, and uses data and transparency to ensure accountability for both the well-being of people and the performance of programs. In turning the curve using RBA, some of the questions we think about are, what is the end? How are we doing? What is the story? Who are the partners? What could work? And what plan is being proposed? The process is iterative in nature, and we should go back and review the results periodically to ensure that we are obtaining our desired outcomes. Now let's restate what the PSE and PSE change are and dive into each of them individually. A policy is a written statement of a position, decision, or action. It could be in the form of laws, regulations, and the adoption of guidelines. According to Ross Brownson and his fellow researchers, in a review of the 10 great public health achievements of the 20th century, each of them was influenced by policy changes, such as seatbelt laws, or regulations governing permissible workplace exposures. Systems, put simply, are procedures and protocols. And environmental refers to changes in the built or social environment. Now, the built environment is the man-made environment that people interact with. Some built environments that come to mind may include parks, streets, and buildings. Strategies focused on changes to these environments to impact a goal are known as built environment changes. In contrast, the social environment is based on the context of a community, which is made up of the culture, social tendencies, and institutional systems that are within the setting. What individuals have been taught, and many of their beliefs and ways of interacting between themselves and with institutions are influenced by the social environment. An aim of the Live Healthy Community Partnerships is their attempt to make the healthy choice the easy choice. This is an abbreviated version of what Frieden stated as PSE strategies being an economical and sustainable approach and making healthful choices the convenient and most frequently selected choices. So, how do we make the healthy choice an easy choice? By coming up with policies, systems, and environmental changes that make it natural, convenient, and affordable for us to make the healthy choice. We use an 8 step planning framework to get us there. And you can find a link to the one-page handout outlining the steps in more detail near the evaluation link on the webpage. It's an iterative process that incorporates collective impact as a vehicle to form a common agenda and goal, and utilizes a similar RBA and community-informed process to determine the most promising policies, systems, and environmental changes that can lead to long-lasting, cost-effective, and sustainable change. The first step in an 8 step planning framework for developing a strong cap is setting the goal. Set a specific goal that is reflective of what the community wants to achieve. All subsequent steps will rely on this step being genuinely reflective of the community's desired outcome. The conversation typically begins with an overarching goal expressed by a funder, backbone agency, advocate, community organization, or even a social media campaign. And once you've gone through the 8 step framework many times, this overarching goal will yield smaller goals or aims that should go themselves through the 8 step planning framework to continue to yield policies, systems, and environmental changes that can be implemented at all levels. And this is the perfect place to start thinking about the social determinants of health and how the community action plan will impact the root causes of disparities and disease. Once the goal is reflective of the common agenda established by the partners in your collaborative, move on to gathering and gaining knowledge. So, what does gaining knowledge mean to you? How would you go about getting the information? For the second step, it's suggested that you gather information from quantitative and qualitative data that provides insight to the community's status on addressing the goal. Data collection can be expansive and expensive, so use what's accessible already. Many folks have already studied a community, collected input, and have reports with valuable information. Talk with all the partners in your collective impact framework. Have any of them collected recent surveys or have access to data sets? How about free sources like census data or local statistics? Has a strengths, weaknesses, opportunities, and threats or SWOT analysis been conducted by the collaborative? All of this and more can help gather information to tell you where you are with reaching your goal. That said, data in terms of numbers and stories are never enough. We need to dig deeper, so let's move on to step 3, assessing networks and context. This includes noting the social networks that exist in the community and are formed by organized or unorganized groups, meaning those with names and formalities and those without. For example, a homeowners association would be an organized group, and an unorganized group would be the group of kids that walk to school together every morning, or the older adults that meet at the park to play dominoes on Sunday, but are not part of an official park program or social group. All of these groups provide insight to the community's fabric. Additionally, we need to understand the cultural and historical context, as well as the perceptions and social tendencies that could influence achieving the desired goal. This step answers 2 simple questions. Who's in the community, and what do we know about the community? The first 3 steps set the foundation: what the problem is, what do we know, and who's around to impact it. Step 4 takes the conversation one step further to ask, why is the goal not currently being obtained? In other words, why is the easy choice hard or non-existent? What motivates the community to engage in the current behavior that influences the set goal? The answers to these questions could be one word, like crime, expensive, or there could be more of a phrase like, that's the way we've always done it, or in our culture, any other way would be disrespectful or shameful. Any answer received should be written as is and should not be modified by the facilitator. Give ample time to this step and ask various individuals from the collaborative, since everyone may have a different perspective that can help piece together the main question in step 5, intercept change, are what needs to happen to demotivate the individuals to behave the way they're behaving, and what needs to happen to make the easy choice the healthy one. We start this question from an individual standpoint and then begin to think, well, are there additional influences from community, institutional, physical, or association level assets that influence this behavior or could influence the behavior in the desired direction toward our set goal? Note that one or more motivators should be addressed per intercept. Now to step 6, the added piece to all of this. Propose a policy, systems, built or social environment change that implements the intercept or common sense simple changes from step 5 through an evidence-based practice. Each proposed change should leverage existing resources, be sustainable in nature, and be written in SMART objective format. More than one change per intercept is encouraged because that will create what we call the sandwich effect, where a policy complemented by a systems change is likely to be reinforced, and an environmental change can shift culture or physical engagement, encouraging or deterring behavior, all of which act as little arrows going in the same direction and reinforcing the change we want to see. More arrows, more impact. To get to a smart PSE, think about who's responsible for implementing the PS or E, who is impacted by the PS or E, and when would the PS or E be implemented. All of these steps should be included for each proposed strategy. Step 7, monitoring change. This is the time to figure out if what you propose needs tweaking. You can determine this by conducting a process evaluation during the implementation of a PSE change. Then document the progress and identify if any modifications need to be made to achieve the set goal, and if so, adjust accordingly. The sooner you do, the more likely you'll have an impact at the end. Step 8, reassessing the goal, tells you if you made an impact on the set goal. Did you get closer to your North Star? Did you move your needle? To find out, evaluate whether each PSE outcome impacted the set goal. If there's full success in meeting the set goal, then the cycle is complete. Meanwhile, a failure or partial success will add to the knowledge base, and the cycle should be repeated. Also, consider if there are complementary PSEs that could assist in ensuring that the originally proposed PSE is successful. If so, utilize the information gathered from steps 1 through 5 to propose new PSEs. These are what we previously called complementary PSEs, or those that create a sandwich effect by giving off those little arrows all going in the same direction. As we said before, more arrows, more impact, and therefore the more likely that the healthy choice will become the easy choice. The Community Action Plan is what brings together the 3 models that have been used since the inception of the Live Healthy Community Partnerships. It's how we make collective impact, results-based accountability, and PSE changes come to life in order to help reach our desired goals. Locally, there are also several great examples of how policy, systems, and environmental changes have impacted population health outcomes. The WalkSafe program is dedicated to prevention of brain and spinal cord injuries in children and adolescents. Its mission is to prevent pediatric pedestrian hit by car (PHBC) accidents, or in other words, children being hit by cars while walking, through education, promotion of physical activity, and advocacy for safer walking environments. But how did they determine education, promotion, and advocacy would be successful in meeting their goal? For the purposes of this exercise, let's focus on the set goal of preventing accidents involving children walking that are hit by cars, or pediatric pedestrians hit by cars. In step 2, we gather knowledge. Hospital and enforcement data revealed that there was a high rate of children being hit by cars that were between the ages of 5 to 14, and that the greatest need was around inner city public schools with a high proportion of minorities. In step 3, we assess networks and context and ask ourselves, what do we know and who is around to impact it? Now, it was known that in inner cities there were social tendencies for children to walk to school either in groups or alone, and in some areas it was culturally okay to cross at unmarked crosswalks. Well, the WalkSafe program developers were interested researchers from the University of Miami who had received support from its associated Level 1 Trauma Center for the project. The Miami-Dade Public School Board also recognized the need, and a champion, Ms. Perla Hampton, along with the Director of Physical Education, Dr. Jane Greenberg, wanted to address the issue. Step 4. Identify motivators. We ask ourselves, why are children being hit by cars? What's happening that doesn't allow them to walk safely to and from school? Two of the motivators included lack of safe walking skills and lack of safe environments. Now moving to step 5, what needs to happen to make the healthy choice the easy choice? A couple of simple common sense options were to increase safe walking skills and create safe built environments for walking. Now that we've quickly gone through the first 5 steps, let's review what PSEs have come from this program and if they were successful. Once the WalkSafe program became evidence-based, meaning that it was evaluated and published, and its results demonstrated that implementation of the program significantly increased knowledge among children participants, they pursued PSEs. As a reminder, there are many evidence-based programs out there, and you won't need to always create your own or reinvent the wheel. The important thing is to ensure that the policy, systems, and environmental changes that you propose are founded on evidence-based practice. Now, what is a policy change? As we mentioned before, a policy change is a change in written laws that help deter negative behavior and promote positive behavior, and as a result, yield a healthier community by making the healthy choice the easy choice. The WalkSafe policy change happened in 2003 when it was mandated by the Miami-Dade County Public School Board to be implemented on an annual basis at every public school in Miami-Dade County. Systems change, where changes in an organization's procedures and culture toward a desired behavior, were achieved by making the program, the materials, training, and technical assistance free and online. This flexible approach increased adherence in the program by allowing busy teachers and school staff to prepare for the program at their leisure. Additionally, a systems change that impacted the set goal of reducing the number of children hit by cars, and that was also used for an associated WalkSafe goal of promoting physical activity, was the school system's data collection on how children got to and from school. Collecting this exposure data helped monitor behaviors and understand areas of greatest need for intervention. Social environment changes are employed through the dissemination of a communication campaign and an annual Walk to School Day event to ensure that schools receive support toward a culture of safe walking behaviors around the community. WalkSafe is considered a non-infrastructure project because it doesn't build the safe routes, but as an active member of the community traffic safety team, where traffic engineers, transportation planning organizations, school boards, law enforcement, and others work on these issues, WalkSafe collaborates on built environment changes by informing them as to which infrastructure projects would be of greatest need to address pediatric pedestrian hit by car accidents. Although in this example we don't describe step 7 of monitoring change, through the years of implementation, WalkSafe had teachers and schools evaluate the curriculum and activities and modify their deliverance accordingly. Now let's move on to step 8, reassessing WalkSafe's impact. Let's remind ourselves of step 1, the set goal. Prevent pediatric pedestrian hit by car accidents, or in other words, prevent the number of children hit by cars. More than 10 years after the program went countywide, how's it doing? When evaluated by the National Highway Traffic Safety Administration, or the NTHSA, WalkSafe had demonstrated that it was a significant countermeasure in order to reduce the number of children hit by cars in two particular pilot areas, Liberty City and Little Haiti. Although the study was conducted in the early to mid 2000s, the final report wasn't made available until June 2008. Nonetheless, it's an impressive result and something to build off of. As a result, WalkSafe went from only serving hotspot areas for children being hit by cars to serving the entire county. And 10 years later, WalkSafe has demonstrated a reduction in pediatric pedestrian injury rates by 72%. In other words, the rate of a child being hit by a car in Miami-Dade County was reduced by 72% over a 10-year period of time. This is a powerful local example of how well thought out PSEs can have an impact on population health. If you have not already done so, please take a minute to download the Strategic Directions and Examples of CDC Recommended, Evidence-Based, and Practice-Based Strategies table. These resources are a menu that were provided to agencies seeking funding from the CDC for similar policies, systems, and environmental change work. And there's many other resources out there that provide lists of best practices and PSEs in various areas, but to ensure their success, you'll want to undergo a process that has a clear set goal and that is community and data driven. And ask yourself as well, what systems might influence these strategies? Are there policies at an institutional or government level that could facilitate the implementation of these strategies? In terms of the built environment, is access to the settings an issue? Are there built environment features that could be enhanced to assist with healthy behavior engagement? In terms of the social environment, what could be implemented to help morally support the engagement in the healthy behavior? Work through the 8 steps with your collaborative, initiative, work group, sub-council, health impact team, or whatever structure you're currently in, and ask yourself these questions along the way. Remember that each effort can help make the healthy choice the easy choice. Thank you for joining me in this training, and please complete the evaluation and download the materials for your future reference.